Hello everyone, I welcome you to this short video about thrombosis. Being October, a month for awareness of thrombosis, majorly the day is going to be 13th October, but any day of the year we can be spreading the awareness. And I'm making this video to share it with you so that I share what I know about thrombosis with you. You can always make some awareness videos, also pictures, and share them on social media platforms using the hashtag WTDay2022 or WTDay22. You can tag the World Thrombosis Day page on any of the social media platforms using the page name World Thrombosis Day on Instagram, Twitter, Facebook, TikTok, and everywhere. So let's start. What is thrombosis? Thrombosis is a condition where your blood forms a clot within the veins or arteries. This is life-threatening and medical intervention is always necessary with immediate effect. Here we are saying that your blood is making a clot when you still have life and it is forming in your arteries or veins. Think of a scenario where your blood is stacking in the artery or a vein and it's making a clog that is making thin flow of blood not effective. This is life-threatening and it can call for death if not immediately managed. There are two types generally. We have the venous thrombosis and the arterial thrombosis. Venous is where the clot develops in the veins, and this is majorly superficial or deep vein. Superficial is when the clot forms on the superficial areas or the periphery of the veins, and deep is when the clot forms in the deep vein system. This is common in the thighs or leg where we have the deep vein system. The deep vein system is all over the body, but most commonly the effects of clot formation are in the legs, arms, majorly those two parts. With the arterial thrombosis, the clot forms in the arteries, and this is less common compared to venous thrombosis. These are some of the signs and symptoms, how you can get to know that, oh, I really need to see a doctor to assess if I have thrombosis. Swelling of the leg, usually one. If it's for the leg, it can be the right or left. If it's in the arms, it can also be one of the arms, right or left. A throbbing or cramping pain, sharp chest pain that worsens in breathing in. This is common for the pulmonary embolism. You know, embolism and thrombosis are sometimes used interchangeably, but basically, thrombosis is clot formation, blood clot formation, and embolism can be a clot formed, or it can be any article that moves within the blood vessel until it cannot go any further but clogs somewhere. That is an emboli. An emboli can be a blood clot, but a thrombus is purposely a blood clot. Then we have a reddish skin discoloration, swollen veins that are hard and sore on touch. If you see any of these, you need to see a doctor to assess for any of other things that can tell that you're having or developing thrombosis. We have some predisposing factors here. Obesity. This is where you see someone is getting fat and fat. If you are getting fat and fat, you're getting obese and you are predisposed to having thrombosis. Immobility or inactivity. We have a poor practice of really being immobile. Someone has a car, they get into the car early morning, they go to the job is a white collar one, they get into the office, sit and relax. After a long day of sitting, they get up, go to their cars and get home. Immobility, they are not involved in any activity, so we really have to be active so as not to be predisposed. Then family history of thrombosis. If you have a family history of anyone having had thrombosis, you are exposed to having it, you have higher chances than other people of getting thrombosis. High blood cholesterol, high blood pressure. Is thrombosis curable? The answer is yes. The answer is yes, but always we need to be having immediate diagnosis. When you have any of the signs, when you feel any of these signs, you need to see the doctor to assess and to get early management before things worsen, always. So thank you for listening. I kindly request you to share, make also something and share it on your social media platforms using the hashtag WTDay22 with tagging the page of World Thrombosis Day on Instagram, Twitter, Facebook, TikTok, and anywhere else. Thank you for listening.